Well, ever since I was little, I knew I wanted to be involved in helping people, and I always had a passion for sports. And I really looked up to my dad, and growing up, he was one of those guys, he could fix anything. Anything in the house that broke, anything in the car that went bad, he could fix it. And I wanted to do that, but do it with people. And orthopedics really combines those things because you really can fix people very quickly. You know, people come in with a painful hip or a painful knee, and then go out the same day and just be worlds better. I started my residency in 1987, so started doing operations at that point, but really on my own since '92. It's funny because when I was first in medical school, I actually, I thought for a while I wanted to be a cardiothoracic surgeon, cardiovascular surgeon. Just thought that would always be cool, you know, to hold the heart in your hand while it was beating. I said that would be really neat. And actually, my cousin, who was studying orthopedics, he was in an orthopedic residency in New York. He said, "No, you gotta come here and come see us." And I went and did a rotation with him, and that was it. Ever since then, I just fell in love with it. I feel really good about that. I'm going to make someone who's, you know, may not be able to do the things they want to do, can't sleep at night, and I'm going to make them better in a relatively short time frame. So I love seeing the patients come back and just the looks on their faces, and they're so happy. And that makes it fun. That's very gratifying. I had learned about this procedure that was called the direct anterior approach to the hip, and so I said, well, I really want to learn about it because it seemed like a great idea. I was fortunate enough to be an early adopter, the first one in Virginia to do it, so I have the most experience with it, and it's just totally changed my practice since I started doing it in 2006. You know, I've always been somewhat sports oriented my whole life as well, so I like that combination. I like the hands-on, and I like the fact that, you know, in addition to doing a lot of joint arthroplasty, you see a lot of sports medicine injuries, and that's been, I just enjoy that on a personal level. And it's just remarkable the recovery these patients make. It's been great. And, you know, it's made surgery really fun again, because I get these patients that, again, they come from all over to come see me. They expect a lot, and it makes me confident that I can deliver that, and these patients are doing very well. And it makes it fun again.